Welcome to this talk on aspirin and how and why it can be reduced and stopped. So to begin with, the first question to Dr. Jolly is, what is aspirin?
Aspirin is the chemical name is actually acetyl salicylic acid. It is its other forms of salicylic acid was in medical use even from the Hippocrates time itself. That is, it is called a willow. Willow tree is there. That is in the temperate, this European countries and all is very common. Maybe in temperate climate, other is the most common. This willow trees. The willow tree bark is used as it is concoctions from the willow tree bark was used as a medication for a long time. Actually, that is in 1900s, 1850s, that time, the actual form of the aspirin, that is this acetyl salicylic acid, it is made chemically. That is by mixing the sodium salicylate and acetyl chloride. These two are mixed and they produce that one German scientist, I think, produced this acetyl salicylic acid. And then the Bayer, that is it's a German pharmaceutical company, they made it into started marketing, and its brand name is Aspirin. That's why this acetyl salicylic acid is commonly known as aspirin. And that is used, initially it is used, that is the only medicine which was using for the pain. It is anti-inflammatory. Inflammation means that is the symptoms, all the symptoms of diseases are called as signs of inflammation. That is pain, fever, redness, swelling, tiredness. All these symptoms can be reduced with the aspirin. That was the only medication available at that time. So then later other medicines come. Till that time, that is aspirin was the major anti-inflammatory, and it is played a major part in relieving symptoms actually.
Nowadays, it is very much well known in prevention of blood clots. So, what is its action with respect to blood clotting?
See, as I said, initially the aspirin was the only medication for the painkiller and everything. Every aspect, the aspirin was the medicine. Then in 1986, this paracetamol, the acetaminophen was discovered, and then later it came into market, and then this is more powerful in reducing fever management, pain management and all, and also the side effect is less, because the aspirin, the side effect is gastrointestinal bleeding and gastrointestinal discomfort were the major problem. So everyone shifted to this paracetamol, and then in 1980s, I think, this ibuprofen has come, and later so many NSAID, these painkillers have come. So the aspirin's importance was gone. These things are less side effects and more effective, and less side effects compared for this gastrointestinal bleed and the side effects. So then when we start putting the stent, that is I think in 1980s, later 1990s, then it is so common in 2000 by the time this stenting process, that is vascular stents are starting putting this vascular stent. Then to prevent blood clots on the vascular stent, this aspirin again started in the coming. And also for along with that, some studies came that this is preventing heart attack and such things. And then primary prevention, secondary prevention. Primary prevention actually now also studies also not recommending the aspirin for primary prevention of heart attack. That means the person who has not got a heart attack yet. Only for those who are smokers and all, the aspirin has some benefits, as you say. And even for the old people, especially in the old age after 70, even after 60s, the risk of using aspirin for say preventive for heart attack and all is risk for bleeding, especially for the brain bleed is high. So there are also those who are on aspirin also stop if until 70, or I don't know the cutoff age. I think anyway after 70 it is not safe to use. That is, I think, the recommendation.
Why is aspirin now so commonly used, and everyone seems to think that if I am taking aspirin daily, I will be able to keep heart attacks away.
See, that you should know what is actually this. I'm also saying every patient. If a patient I'm giving clinically supported lifestyle correction for those who are suffering from multiple lifestyle diseases, and those who have been asked for a bypass or to put stent, or already they had one or two stent and bypass and all already over, and the symptoms are persisting. There, when you are there looking for an option, such people are coming to me. So, or those who are on diabetes, they want to reverse diabetes, or they are on diabetes and hypertension, they want to reverse, or they were having arthritis, or they are asked for a knee replacement. And when they don't have their major problem, the now concern is knee replacement, they want to avoid, but they will be already having diabetes and hypertension and all. But for such patients, I'm seeing almost everyone is taking aspirin also. If they are cardiac patients or already some heart pain or something has already happened, may not be an attack, even though if a heart pain or some pain and they are taken advice from a hospital cardiology unit, they will be on aspirin, clopidogrel, and statin also. It's both the three of the combinations are together as a single tablet, and the patient is thinking that they are taking one tablet. Actually, they are taking double anticoagulant or blood thinner, antiplatelet medicine plus a statin also. So that is the trend now, because some medical associations or cardiology associations or someone will recommend this is the thing, and then all the doctors will follow that. And if someone is not following, if the patient get an attack, he has or she has to answer. So everyone, doctors also, whatever they feel, nowadays they have to follow certain protocols, otherwise court will ask if a patient give a complaint or a this is consumer court, everything is there now. So if it is under why this patient is not given under aspirin, then the doctor himself will find it difficult to say why he has not given. So that is the reason everyone is, because when a patient comes to a modern medicine doctor or cardiologist, they are bound to give them medicine. They are not coming for a lifestyle advice. They want medicine. They want a medical cure. They want a pharmaceutical cure, or they want a surgical cure. So modern medicine doctors can give only that. They are not. The patient is not coming for a lifestyle advice, and the patient is doctors always give first lifestyle advice, and only when the patient fails to make the necessary lifestyle advice, then they have to go for medicine. When they are on medicine, they are to further build upon the medicine. That is the trend.
Actually, those who take aspirin, they always have this complaint about their stomach issues, digestive issues, and all that. So, what is it that how can that be managed?
See, stomach, the aspirin, that we should know how is aspirin. That also, this aspirin is an anti-inflammatory agent that as it acts as a antiplatelet agent, and it has other functions also. This when aspirin is taken, there is a COX-1 pathway and COX-2 pathway is there. This COX-2 pathway is activated. That is the reason when there is a acid buildup and ulceration problem can come. So that is the reason for this. When the people take a aspirin, they will be having that is the major complication which can come also. gastrointestinal bleed. And ulcers, we know the intestinal ulcers, the patients may not be aware, know how it is. Ulcer on the skin, just like it can ulcer, mucous membrane can have ulcers. We are taking all this food, all the spicy and other things we are putting inside our stomach, no? So when there is an ulcer, just imagine an ulcer and then you are putting all the spices and all on that. Just like we are adding that, and also you are adding medicines. That is again ulcerogenic. This aspirin sort of things are ulcer, they are prone for it. Then what we are doing is now we are giving in a proton pump inhibitor. Proton means hydrogen, that is the proton. And this hydrochloric acid is the acid inside our stomach, no? So that production is inhibited. Hydrochloric acid production is inhibited by this proton pump inhibitor. That is why with all the aspirin tablets you are giving this proton pump inhibitors also as a co-prescription.
Actually, this aspirin, the bleeding is considered a major issue associated with aspirin. What is the problem?
Okay. See, first we should know how this aspirin works actually. All the cardiac patients are taking aspirin actually. Why it is given, that we should understand. Aspirin's action is, it blocks the action of the platelets. Actually, it's an anti-platelet medication. This aspirin, if I am taking an aspirin tablet, my platelets are always produced in our body. That's bone marrow is producing the platelets. This during the process of its making, when the aspirin is present there, it will block the certain enzymes that is called COX, cyclooxygenates, that is CLOX. Usually this aspirin and all the anti-inflammatory, this sort of medicines are come under COX inhibitors. So this will inhibit the process of the platelets' ability to make clots. So actually this action of the aspirin is suicidal action. It's called a suicidal action because it will not reverse. Once during the process of its making, this aspirin is exposed to aspirin, it will not be effective in clotting. So that is the purpose of not to make our blood clot. That is the purpose of this aspirin actually. And why? It is a natural mechanism. It is a protective. It's a part of the immune system. This clotting mechanism is a part of the immune system. If you have a wound, or inside internal wound, or external, or a blood vessel is stirred, it may start bleeding. It is the platelet is to stop that bleeding. So the white blood cells, WBCs, their function is to kill the bacteria or viruses or whatever biological microbes they have to kill. And this platelet's function is to protect the blood, keep the blood flowing. And if there is a bleeding occurs, to seal that. If it is in the brain, there is a small bleed or something, it will go and seal that. Or in the liver, that are soft tissues, there can bleeding can happen. Anywhere, or on the skin, a cut is there, or a bruise is there, internal muscle, there is a blood vessel is open, they will stop the bleeding. But this action is blocked actually. Why for the heart patients this action, we are blocking this action? Because the heart block and all forms how? It is actually the fat deposits, excess fat which is flowing inside, because the cardiac patients all will be having excess triglyceride and cholesterol and all. So excess fat is flowing inside our blood, and it will get, there is no place to deposit, so it will get deposited gradually inside our blood vessel itself. So it will form some sort of a swelling inside the blood vessels. And sometimes this, when at times it will start break and bleed. Bleed means it is actually the fat itself will come out. and ooze it out. And when it is fat or something is oozing out, this platelet will go and seal off that area. And the other, this clotting mechanism, other fibrin and all comes and make a mesh, and the clot is formed, and white red blood cells and all get touched, and the blood vessel will get blocked. So that is a possibility for every patient who is having atheromas, that is the internal fat deposition inside the blood vessel. And cardiac patients, the primary reason for this heart attack and all is because of this atheromas and oozing out from that, and the block is formed. So when there is an oozing out, and if the platelets are not active, they will not be able to act. So we are purposely making them inactive. And we are actually, by taking aspirin, you are not reducing the heart block or anything, only to make the platelet inactive and stop clotting. That way, that is the reason for giving platelets actually, aspirin actually.
Those who have asthma also, it is said that aspirin should be taken with caution. What is the reason for that?
See, aspirin is an anti-inflammatory agent, and this that means it is a COX-1 and 2 inhibitor. Yes, or a cycle. Actually, aspirin act on the pathway. All these medications must not only this COX, there are this lipooxygenase, cyclooxygenase, and all this actually comes from the omega-6 pathway. That is arachidonic acid pathway. That is actually what we take this food, sunflower oil, and all these vegetable oils and nuts, most of them having very high omega-6 fat. This omega-6 fat is finally in the mechanism, actually omega-3 and omega-6 fat is actually controlling our immune system. One is this 6 is inflammatory, and the 3 is anti-inflammatory or healing. In our food, this omega-6 fat is very high. That is why nowadays this inflammatory diseases, lifestyle diseases, all are inflammatory, and it is in the high because of this high inflammatory food. Especially the other toxins are there that also are inhibitory, but one of the major thing is omega-6. That is finally converted into arachidonic acid, and this arachidonic pathway is actually this producing thromboxane. It is thromboxane and this prostaglandin and all this sort of chemicals. Actually, this finally, whatever this platelet is inactivated also through this pathway only. So when we block this thing, in the lungs also there is some constriction, relaxation, and all the muscular actions are there. So it is as a side effect, the major side effect of this aspirin and all this NSAID medication is, one is increasing the chance of asthma. That is because the action of this same medicine is in a different way in the lungs. Actually, when a medicine is taken, we think that we are taking for not the platelet to inactivate for a cardiac patient. But it is not like that. There is the action is there all throughout the intestine. It is there. It will reach all the cells in our body. When we take a medicine, it will get absorbed into the bloodstream, and it will be distributed all over the body. So it will be having some action in the brain, some action in the lungs and all. So as a part of the action on the lungs, it will aggravate the asthma. And as a part of the action in the stomach, it can produce ulcers and bleeding because of the this interference with the acid metabolism, acid production. And
aspirin, we understand, is increasing the risk of bleeding and all that. At the same time, those who are recommended aspirin because of their problems related to blockages or heart conditions, normally they will they may be suffering from one or more other diseases like liver problems or kidney problems or diabetes issues or rheumatoid arthritis or GI problems. So invariably these patients will also be suffering from one or more of these other issues. So in such a condition, when they say that if you are taking aspirin, you should be careful if you have this disease, that disease, this disease. Then in such a situation, what can a patient who has to take aspirin but has these one or more of these other problems, what can they do?
See, all these problems comes under lifestyle diseases. You are taking aspirin because you are not able to do your work that is correct to your lifestyle. If you are having hypertension, actually what I am saying is the patients will be having not one disease. They will be having diabetes, hypertension, uric acid, high uric acid, everything they will be taking medicine, and they will be definitely for a patient who is on medication for diabetes and hypertension will gradually end up with a heart attack. If it is a minor heart attack, they will survive and they will start taking aspirin. Or even diabetic patients as a prophylaxis, many of the physicians nowadays give a and hypertension patients also they are giving a even though there is no problem as start there is even the cholesterol level is normal, they will usually many of the patients are taking a statin and also aspirin. So we should know what is the patients should be knowing what is the risk also. Say aspirin is contraindicated for the elderly. That is very clearly now. I think there is clear direction is there. If a patient is continuing with the aspirin after 70 and all, their chance of getting a brain bleeding or a major bleeding problem is high. The risk is higher than the benefits, definitely. But for the young children, they are not supposed to take aspirin. That is before 18 years, I think. They are before 19 years, they are not supposed to take aspirin. But aspirin is a non-prescription medicine in many of the countries. So I think there is warnings and all. If the children is taking aspirin, there is major complications actually that will come later.
The question was basically, if you are supposed to take aspirin and you have one or more of the following disorders like liver disorder or kidney problem or say gastrointestinal problem.
And also what usually seen is patients with hypertension. And all these problems will be there. They are on 3 or 4 hypertensive, 1 or 3, 4 many antihypertensive medicines also. These patients also will be taking antiplatelet medicine like aspirin. The real problem is such patients, it is very high risk actually, because the most dreaded complication of a hypertensive patient is a hemorrhagic stroke. If a hemorrhage occurs, or because if the pressure is high, when the pressure shoot up, the brain is the most smallest vessels. Smallest vessels will be having that is the most friable. So there can be a small bleed. But if you are on aspirin, there is a chance for getting this bleeding can go to an extent and can go for a stroke. And for example, I can tell you one example. You might have been noticed that recently one of our major spiritual leaders had a subdural hematoma in the brain, and he was hospitalized and needed an emergency surgery. He was a very healthy person, but he was on aspirin also. I don't know why the reason for aspirin. But a person who is very active and who is riding motorcycles or sporty activities and all, it is supposed to be, they should be very careful. And yes, if you are on such a aspirin medication, you should not go for such things. That is the most important, because if you get a small injury, you may not, if you get a shake or something like that, you may not notice it also. But if a small injury happens, the natural blood clotting mechanism is stopped. If there is no aspirin, this bleeding will not aggravate and produce. That will be sealed off immediately, and patch work is done. That is small bleeding, and all the blood will be absorbed into the system, and the extra blood will be absorbed soon. But if you are taking the aspirin, this bleeding will not stop because there is no mechanism. And also, the patient, if a patient get a brain bleed, they will be having severe headache. And if person taken again for the painkillers, these painkillers also comes under this NSAID, and they have the same mechanism of action, and they will aggravate this antiplatelet effect. So antiplatelet effect is aggravated, the bleeding will continue. That is what happens in such cases. And I have seen many other patients also, and who was who was survived, that is admitted in subdural hematoma, that is inside the, just under the skull, and you can operate it easily and take out, and the patient is survived. But if it is a subdural hemorrhage, subarachnoid hemorrhage, or intra brain bleeding into the matter, gray matter or white matter, you can't do any surgery. You can only just wait and body's immune system to work for you. That is the only thing you can do. Only for if intracranial bleed and all, only for the subdural, just under the skull, under the bone, you can do. Otherwise, the modern medicines, we can do any much for the report. Only wait and see, only support medication can be given. That we should remember. So we are actually, by giving medicines, many times we are adding complications, and many times the complications of medication is giving you your life-threatening complications or your quality of life. Even if you were saved from that thing, your other quality of life may be decreased. So that is the first important thing. You should, those who are on, especially those who are, if you are taking hypertension medicine and aspirin or this thing, you should be very, very careful.
Okay, regarding children, it is generally said that aspirin should be avoided. So what happens in the case of children who are having a problem of circulatory system blockages and something like that?
See, aspirin is an anti-inflammatory agent. It is very proved for the pain and discomforts and all. So it's even aspirin is a outside prescription and counter medicine actually in many of the countries. So now there is warning about this use of aspirin for the children. Actually, it has happened. For the aspirin, if it is given for the children, especially for fever, we are taking painkillers and these things, fever, or for the viral infection and bacterial infection and all. No? If the children is taken, there is a chance for a Reye's syndrome. Reye's syndrome means there is a damage to the liver and the brain. If it occurs, the chance of death is almost 40 to 60%. And even if the child survives, there is a possibility of brain damage. So it's a major thing. And it is actually in Europe and America and all, stopped using it for the children. And this Reye's syndrome is subsided, almost reduced. Actually, it's a marked decrease in the Reye's syndrome also. So it's a major, it's usually below 5 years, and also teenagers and all, it can happen. So because it is a counter over-the-counter medicine, everyone should be very careful about not to use for the under 19 years old children, even the teenagers also. That is, and the mechanism nowadays and this why it happens and all, actually this aspirin has some damage into the mitochondria actually. The cellular mitochondria, especially in the liver and the brain, it is damaging, and there is some mechanisms, that is why it is happening.
Actually, those who take aspirin, many of them also have reason to, it seems, take statin also. So this, what is it that the person who is taking both statin and aspirin simultaneously should know?
See, aspirin is taken for making the not to prevent the formation of clot inside the blood vessel. Why the clot is formed inside the blood vessel? Because of the fat deposit and forming small swellings like atheromas, and the fat ooze out from that, and the platelets go and make a clot there. So to prevent that, the fat oozing will happen, and so to prevent, we are actually what we should do. We should reduce the fat deposits inside the cell, and to reduce the triglyceride in the blood. This instead of that, we are blocking the cholesterol synthesis. Actually, cholesterol is not from our food. We can directly control the cholesterol level in the blood. Cholesterol is present only in the animal food, like egg, milk, fish, meat, and all. There is cholesterol. But the major non-vegetarians and vegans also have a high cholesterol. That is, the cholesterol is high because there is a metabolic block. Cholesterol is needed for the vitamin D. If your vitamin D level is low, the cholesterol level will go high. If your glucocorticoid or mineralocorticoid, that is mineralocorticoid is controlling your electrolyte balance, if there is a production block, there is the chance for the cholesterol to go high. It is needed for the formation, the production of the sex hormones. If your body is, if the when you are in the production of the sex hormones is there is a block, then this cholesterol will go high. If the thyroid, you have a thyroid problem, the cholesterol will go high. So if or even when your body is recuperating some disease, you need more cells to form. Now newer cells has to be built. For this cholesterol is needed for the building of the cells, especially that cell wall, cell membrane. The cholesterol is needed. That gives the integrity for the cell. So for all these purposes, cholesterol is needed. The cholesterol is almost all the cells in our body can produce cholesterol, and especially the liver is the production unit. And even the bile juice, this bile salt that is needed for this digestion, that is also produced from the cholesterol. So if there is a deficit, is a block in the production of any of this metabolic process, the cholesterol can go high. So just because there is fat is there blocking the cholesterol, it's not a scientific way, it's not correct basically. What you have to do is reduce the fat level and reduce the blood fat deposits in the blood vessels and correct the thing. Because if you go like that, then it is a strain for the, when you're taking this statins, it is a strain for the liver. Even the this aspirin is going directly into the liver, and it's already that diabetic and hypertensive patients, and there are already blood vessels are damaged, and there is fatty liver is there. So it is not liver is very finding it difficult to do liver, it is their own work. Then you are adding with the medicines, when you are adding your statin and aspirin and one or two medicine for the diabetes, hypertension, all it's all adding the work of the liver and also to the kidney also. The diabetic patients, hypertensive patient, kidney already compromised. So whenever you take, you remember that whenever you take a medicine, you are adding the workload of all your system, especially the liver, kidney, and even the skin. The these patients who are on many medications, their skin will be get darkened, and even itching can start coming, and dark pigmentation or redness and all coming, because the liver and kidney, when liver and kidney is not able to remove the toxin, it will come to the skin. Next option is only through the sweat, and so it will be coming, and then you start itching, and other discomfort will start coming.
See, the aspirin is suggested or prescribed and taken primarily to prevent clots within the blood vessels. At the same time, if for instance a patient feels that it is better to avoid aspirin because of some other ailments he has, or other bleeding factors that the patient has, or otherwise also they would not like to take medication lifelong because they may have some other irritants like stomach issues or some other indications. In such a situation, what can a patient do if they decide on that I would like to reduce on taking this medicine and stop it also, if possible?
See, I'm basically focused on lifestyle correction. I'm giving clinically supported lifestyle correction for those patients who is not able to correct lifestyle by themselves. My experience is with patients like already on so many medicines, like the heart patients are the one who's taking aspirin. No? They must have been already some maybe already had a stent and one or two stent, and again they are asked for a TMT positive and asked for a angiogram again, or someone who's asked for angiogram but they cannot do angiogram because the GFR, kidney function, is low, or they are already had undergone bypass and many times stenting and nothing can be done. All sort of patients are. I had experience with almost with all these different sort of before bypass, or asking for repeat bypass, repeat stenting, all sort of patients I have seen. And almost all these patients having not only heart problem, they'll be having cardiac problem. This hypertension will be there. They'll be taking medicine for hypertension, cholesterol, diabetes. This moon is almost everywhere it will be there. And also maybe for the uric acid or arthritis or anything. All these diseases comes under the lifestyle diseases. So in the clinically supported lifestyle correction, what we are doing is to give sufficient nutrition, sufficient exercise in the optimal way, and reduce toxins coming into the body. And even the patient is taking 30 years insulin and diabetic medicine, or 40 years for hypertension, with this lifestyle correction, with this support food and exercise, almost all the medicines can be reduced in the first month itself, can reduced and stopped. And we are not, it is possible to do that, but don't do it just simply like that. Only with the correction and according to the blood parameters. For the type 2 diabetes patients, even if the patient is taking 4 or 5 or tablets and insulin also, If it's a type 2 diabetes, that we will find out from the level of insulin or C-peptide level, checking what is the pancreatic reserve. And if the pancreas is producing insulin, we can stop the all the diabetic patient, all the diabetic medicines. It's a type 2 diabetes. Type 2 diabetes is because of the insulin resistance. So we had to overcome the insulin resistance. So next day, after stopping the insulin and started on the new diet, we can see the result within 2 hours. If you are 8 o'clock, you are starting your first supported meal, and 10 o'clock, after stopping all these medicines, 10 o'clock you are repeating the blood sugar, you can see the result. And most, if the patient is following everything correctly, for most of the patients will get the diabetic control, blood sugar control within 24 to 48 hours. And we can, and also within 2-3 days the BP started getting down. The diabetic medicines stop at the first day. When the BP also to be recorded 4 times a day, because a person on BP medicine. And when the BP comes down, we can stop. Many patients will be having 3-4 medicines and all for. One with at a time, one tablet or half, reduce the dose, and most, if the patient 1 or 2 medicines within 1 or 2 week itself we can stop. Some patients within few days itself for only one medicine. Usually by the 8th day review time they would have been out from the medicine. But the sugar BP is normal. With the BP normal only we can come down. Normal, then gradually reduce. And also cholesterol medicines. Usually the triglyceride and all will be high even with the statin 40 milligram, 80 milligram and all. But on the 8th day itself, the triglyceride will definitely come down. Cholesterol may be taking little more time because it is the internal mechanisms which is making the cholesterol high. And also there is a rebuilding process is taking place. So for the new cells to produce and all, there is cholesterol is needed. So we are not looking for a 150 cholesterol or anything. We will be wanting around 200 cholesterol, that will be there. Then this cholesterol medicine also we cannot stop abruptly. Diabetic medicine we can stop abruptly, but BP medicine, cholesterol medicine, psychiatric medicines and all, only gradually we can stop. But almost all the medicines can be stopped within a month. Psychiatric medicines, it will take some more time because that is having an addiction formation will be there. So it has to be more, if 1 or 2 medicines we may be having 1 or 2, every medicine it will take some more time because we had to reduce in slowly withdrawal. That is the pattern we are doing. And I have not seen any failure. Failure is only from the part if the patient fails, or it's an end organ disease like a kidney failed. So it is kidney creatinine and all like 4 or 5. Then you can't bring the creatinine level to normal or anything because kidney function this fifth level renal failure and all, you cannot bring it back. But you can, if the patient is willing for the lifestyle correction, they may be able to avoid dialysis and they can pull on and stop all the medicine. Those patients also, diabetic who are on renal failure also, will be able to stop all the medicines for the diabetes and hypertension and all. Even for the renal failure patients, even usually the most difficult to control BP is for the renal failure patient. But even such patients also, BP medicines also can be tapered off with a normal BP thing. So then the chance of going for dialysis can be reduced. And when the diabetic medicines is stopped and all the medicines are stopped, those who are on fourth level renal failure or third level renal failure, it can go up. If the fourth level can be brought up to third level, and third level to second level, and even second and third level maybe come to normal also. That is the pattern I have seen.
Many of the patients who are on aspirin will also be on multiple other medications. So what is it that can be done by them if they want to reduce on medications? Because usually with too many medications, it is generally felt nowadays that these medications can act against each other and make the person miserable.
See, medications, multiple medications, it will interact, and it is the most important is the stomach discomfort itself, and so many other, because if it is a diabetic patients, the blood sugar is going up and down. BP patients, the BP is going up and down. So when the medicine acting, it will be down, and if you forget to take once, and when you are in a stress or when you are in a difficult situation, you will forget or you won't be able to take the medicine. Then it will shoot up. So abrupt one, as you know, it's all only for 3 hours, 8 hours, 12 hours. The action of this medicine is only for that much time. So if you don't take it in the correct time, then definitely it will even this BP and all, it will shoot up. And cholesterol medicine, if you are stopping for a few days, the cholesterol will shoot up. It is not in the normal level, it will go very high. So what is the reason why you are taking all this medicine? What is the reason for this disease? You are taking the medicine to control BP. You are taking the diabetic medicine for controlling the sugar. If you are taking the cholesterol, you are controlling for the sugar. Why this sugar is going high? 90% of the diabetes is type 2 diabetes. These type 2 diabetes patients are having this, adult onset diabetes patients are having all these complications. They are the one who's taking all these medicines also. It's all lifestyle diseases. We should know that it is not because of the lack of medicine you are getting the sugar is going high. It is not because of the lack of medicine your sugar BP is going high. It is not because the lack of medicine your cholesterol is going up. It is because of your lifestyle these problems are coming. You are eating more carbohydrate, more than what is needed for you. See, nature has a rule that you should not take more than what is needed from the nature. So if you are taking more than what is needed for you, your body, definitely it will manifest as sickness. That is the reason for the type 2 diabetes. You should control your food according to your exercise or according to the activity. You should have take from nature only what is necessary for you or what is necessary for your activities. If you are not taking more than that, you get the sickness. You find it, and also if you're taking which is more toxins going inside. Now this all this food with the preservatives, color, tastemakers, and it is so tasty, and you eat more. So all around it is food. So many advertisements. When you open the TV, there is so many advertisements. If you go to a mall, so beautifully arranged items are there, and all with 50% reduction. You grab it and take it and bring it home. So it's all tasty. Also, we take it. So we should have a control over that. Then you can control come out of all these medicines. But if you are just starting a diabetes, only a pre-diabetic or only one medicine for BP, you just do your reduce your calorie. Reduce actually for the BP patient, we should be very careful that this omega 6 oriented, that is an inflammatory, that your body is controlled. Just the major control mechanisms of your whole system, the cellular mechanism, the control is in the omega 6 and omega 6 3 fat. That is in for that fats higher forms, arachidonic acid for the omega 6 side, and EP and DHA from the omega 3 side. They are actually controlling all mechanisms inside the cellular level. And it's even if the fat is having more omega 6 fat, that is if you are eating more nuts, more using high omega-3 oils like sunflower oil and all vegetable oil, your BP can go high. So you had to control, you had to know what is needed for your body. Then only you can correct yourself. Actually, we learn for the 10 years at the school, 2 years at nursery, then 10 years at school, and 4 or 5 years as a graduation, 3, 4 years graduation, and then, but we are learning so many things, but we are not learning much about how our body is functioning. And previously, even when I was a medical student almost 40 years back, we were not knowing many of the things, how these mechanisms of this cellular mechanism, of very little knowledge. But now we know almost all what is needed for our body, how much vitamin, how much minerals, how much amino acids or protein, fat, all the things we know. There are feeders that for the chicken, there is ideal feed is there. For the cows, we want milk. So we have this cattle feed in the correct proportion. And there is a vitamin actually, I'm doing this development and also we are looking into the all-in-one vitamin. Actually, it is not available in India in any form as a supplement also. But we some Western UK, Europe, US and all all-in vitamin supplement is now it is also available here. But for the cattle feed and for the poultry feed, it is available. Feeder grade is available, not for human grade. So we are so concerned about the result of the cows and the chicken we are breeding or bringing up, but we are not thinking about how a human, it's one child, what is the need of a child. Actually, we are human, we are eating only for the taste, not for the nutrition. But we are very careful about feeding the cattle and the poultry and all in the perfect form because we want the result. But we are not doing that same for the human being. We also need the correct nutrition, correct exercise and everything. Then all these diseases can be, because that is, I am telling it from my experience, not just a theoretical thing I am telling. That is my experience. I am giving treatment for this multiple lifestyle disease, and I am seeing it is corrected. All, everything, whatever, how many, 10 or whatever diseases are there, the parallel benefit is there. Only thing, the patient should be willing for the correction. If they are not obeying, then there's no use, because as you know, if a child is put into or you are joining a course and you are not following the things properly, you may fail. If a person fails, means they are not able to manage. If your body is failing, that means it is supposed to function around 100 to 120 years, at least 80 to 120 years is the lifespan of the body. And there is definitely genetics plays a major role. Role is there, but equally the other factors is the lifestyle factors. If you, there may be limitations, even if you have a limitation in your genetics, like prone for heart attack or breast cancer or whatever. If you are correcting your body correctly, if you are managing your body, there is a chance for you can escape also.
I think with that we come to the end of this discussion. Thank you.